Pamela Stoneburner has been with Kids First since the day they opened in January 2000. She remembers a time when a rate-limiting factor to the growth and optimal performance of Kids First was its dependence on a paper record system.
Before we had electronic health records, it was a mess. The reason that I became involved as heavily as I did in the early years of the practice was because with the paper records, we had a horrible accounts receivable follow-up problem.
Anika Potts, office coordinator, the resident super user, manages the monitoring of credentialing, oversees billing, reviews claims to make sure the appropriate codes are being used, while maintaining the EHR system, making sure that the clinical and administrative components are working.
Because my understanding of our EMR service, they call me quote unquote a super user, I'm able to make sure that the clinical and the administrative side of our system is working properly.
Dr. Wanda Williams has been with the practice since 2003. She remembers a period before owning an electronic health record system when a great deal of time was devoted to trying to decipher the poor penmanship of her colleagues and hunting down misplaced records.
Before electronic medical records, there were 3 physicians and 1 nurse practitioner, so the 4 of us writing our own notes. It would be a matter of us knowing one another's handwriting sometimes to figure out what happened at the last visit. And deciphering their handwriting. We'd also sometimes get calls from pharmacists wanting us to decipher the handwriting of one of our colleagues. And we'd have to know what they did or try to get in touch with one another or get background from the parent to find out what it might have been.
Before electronic medical records, we were writing everything.
I had to pull a paper chart for every transaction.
It would be a matter of us knowing one another's handwriting sometimes to figure out what happened at the last visit.
I would take all the claims home and handwrite them.
Since committing to the EHR system, Stoneburner has witnessed great strides in the care delivered at the practice. From her vantage point on the administrative side, documentation has improved and the billing has been enhanced. But this wasn't an easy process. Converting from paper to a non-tangible entity generated fear from her providers.
I think anytime you go from a paper, something I can touch, something I can hold, there's fear. Fear that I'm not going to get enough information onto the page. And each one of my providers transitioned at a different rate.
The learning curve was, it was a little steep at first, but the more, it's like anything, the more you practice it, the better you get at it.
It's not an easy transition going from paper to electronic medical records, but we just did it gradually. So it's just the transition was kind of awkward initially.
Much of the great success of the EHR system can be attributed to their relationship with the GA-HITREC.
There has been individuals there that have been very helpful, that any question we had was addressed.
It's been my pleasure to work with a couple of the high-tech consultants, and Lenny Stinson and Liz Hansen have been instrumental in helping me find the right avenue.
Within her 8 years at Kids First, she has witnessed the maturation of the center with the evolution of the EHR system. In using Greenway, they committed to a system that offered a comprehensive approach that included tech support and hands-on training.
The choice was made after looking at 3 or 4 different vendors at the time.
Greenway, best system, hands down.
At the time, they had promised us or assured us that they would be not just an electronic medical record keeping company, but they would be electronic health records, so they would be a EHR. So that to us said, okay, they are definitely ahead of the game.
I think overall the EMR has allowed the practitioner to practice in a higher quality environment.
The longest time we've ever had to wait is 30 minutes for them to call us back. They call us back, they work with us, they get it done. Just like that. We have never had to go a full day off our electronic record.
I think you could ask anybody on my staff and they would tell you they would never go back to paper. And for many of our new staff, they've never been on paper.
Will enhance your life because sometimes you seem tied down to the desk, to the office when you have only paper records.
The best thing we could have done was got on electronic records because your turnaround time, and that's what you're looking for, turnaround time, is so important.
We took it gradual, but now we are fully immersed in it, and we couldn't even imagine going back to a paper.